Hello and welcome to Rock Your Block. I'm your host and producer, Tia Young. Our special guest today is a dentist with practices in Tyson's Corner and Chantilly, Virginia. Our guest aims to take the pain, ouch, out of dentistry and thinks of his practice as an oral health and dental wellness center. He completed his degree in general dentistry in 1996, followed by 3 years of intensive training in the study of prosthodontics, the discipline focusing on full mouth rehabilitation. This field of dentistry pays special attention to the aesthetic appearance and clinical reconstruction of the mouth. Our guest received his prosthodontic specialty training at the highly esteemed and prestigious Boston University Henry M. Goldman School of Dental Medicine in 2009. Please welcome to the Rock Your Block set, Dr. Alan Filali. Dr. Filali, welcome.
Thank you. Thank you for having me.
Yes. Well, we have a lot to get covered, but there's one important thing that you have to do. I need your doctor pose.
Okay.
So on the count of 3.
Okay.
1, 2, 3.
I think that's my pose.
Okay, great. Well, explain to us what dental implants are, and are implants for everyone?
Sure. Pretty much dental implant now, it's becoming the standard of care for missing teeth. So pretty much what an implant is the titanium screw, if you will, that once we have a missing tooth that goes into the bone and we'll wait about 4 months for that implant to osteointegrate to the bone, and after that we can use it to replace a missing tooth, or we can use it to benefit to stabilize a denture. So that's what the implant is. So any missing teeth now, our first choice really is to replace it with a dental implant.
Okay. Well, what do you say to those people who are, say, over 70, and they come to you to consider dentures or implants or a combination thereof? Is there an age that's too old for implants?
So it's never too old. Especially, that's a good question for the dental implant for like 70 and more, especially for patients who are completely edentulous with no teeth. So usually those cases and those prostheses that we do are made for patients usually like over 60 or 65, 70 and even more. We usually don't do a denture for like younger people, like in their 20s or so. So if you're like in your, and it's amazing what you can do with an implant with what we call like all-on-4 and all-on-6, only with 2 implants, like I was showing in cases like that, where you can have a 2 implant and you can have a denture that can kind of click to that, and it doesn't move anymore.
Wow, that's
and those cases are done for like older age, just like you said, 70 and 75, and they benefit from it. So of course, I mean, for people who like dentulous completely, don't think implant is not for you, because we have a solution almost for everyone.
Right. Well, I have to give a special thanks to you for what you did for our mother. My mom is, as you know, 98 years old, and she has dementia. And I don't know if I had shared that with you or not, but she does have dementia, and she likes to hide her teeth. She likes to hide her teeth from me. And so this one day, that's what she had done. I found them, and I was taking her upstairs. So I had my right hand balancing her up the steps, and in the left, I had her dentures.
Okay.
She began to stumble a little bit, so I dropped the dentures and made sure that she didn't fall. We got upstairs fine. but her dentures were destroyed.
Destroy,
And that's when I called you.
Yes,
And I
yes, I
really,
remember,
I
yeah.
really thought you were going to tell me that she, you know, she was too old at her age.
Oh, yeah, absolutely
But
not.
no, I mean, you guys did a great job. Your staff were very patient with her.
Thank you, yeah.
And you were patient with her and with my sister
She was
and myself.
amazing, and we got her right around her
Yeah.
birthday.
And so she's so happy now, and
that's
you know,
very
she's
good.
wearing her dentures. She's not having any problems at all.
And
so
they look very good.
thank you so much.
Oh, you're very
Thank
welcome.
you for that.
You're very welcome, of course, of course.
And now, what do you recommend to people who don't have any bone left?
So, so this is one of the challenging with the implant. But I mean, the technology now and the research on the bone graft and bone replacement, it's so advanced that even if someone doesn't have a lot of bone resorption or not a lot of bone to place an implant, there's always way to gain that. There's always we can do like a block graft, or sometimes we can take from different part of the body and graft it where the patient doesn't have any bone. So there's always a solution. It might take a little longer, but there's always a solution on how to replace a bone and you know, and finally place an implant, and the patient can benefit from that. So.
I have met some people, and they have been younger, like in their 40s, and they have dentures already. And some of them are complaining that they have a hard time finding adhesive to keep the dentures in. And some of them have actually been in meetings and start talking in their teeth.
Yes,
you know,
yeah.
Karen, do you have any?
So I think like if someone is because a lot of patients sometimes when they wear a denture and for years, let's say 10, 15 years, and sometimes the bones shrink a little bit, but a denture doesn't. So it start becoming very loose and use a lot of adhesive. The best thing to do, I think, is to contact their dentist. And there's something called like reline. You can do a hard reline to a denture, means rebase the denture. And it's becoming like it will become like a new denture, so you will use that adhesive less and less.
Right.
So it's very helpful. So if you find if the patient find themselves using a lot of adhesive, probably contacting their dentist will be and ask for like a reline, what we call a rebase. That will benefit a lot for that issue. Yeah.
Now, a person can actually have dentures or partial dentures and implants. To help that denture stay in, is there a certain number of implants that they have to have to keep it in?
Yes, I mean, so for there's a range of implant, the number of implant, because it goes from a small number of implant to a large, you know, like a 6 or 7 or 8 implants sometimes, where you can actually have your dentition back in like you had it before. The minimum, to answer your question, the minimum implant for the lower, it's 2 implant. And just like I show here, we can go with 2 implant like that, right? And you can have a denture, and you can see here, it's like a male and female, and go, and then that will help stabilize this denture. That's for the lower, it's 2. For the upper, you can, the minimum is 4. It's the same idea, and you can have 4 like that, and that will stabilize the denture. Now, if you want to kind of like upgrade and have something fixed, we have this case here, which is a full zirconia, and it's holding on 7 implant like that. So that's kind of like the high end when it comes to implant, where you can place multiple implant, and this doesn't move at all. So you will have to remove it maybe once a year or every 2 years to clean it. But this is just like having your teeth back in place. So it depends, you know, where you want to go with the implant, and you know, how involved. Like, but a simple like 2 implant like that can hold a denture of the entire arch, which is amazing.
Right,
Yeah.
that is amazing. What is the youngest age of patient that you've had that could have an implant, safely have an implant?
So usually we want to wait for the growth. Usually I wait around 18 to 20. A lot of patients sometimes will lose their teeth,
True.
their molars when they're like 14 and 15 or even younger than that. And I really don't recommend an implant at that point because the teeth still moving. So because once you place an implant, it doesn't move. The teeth do move, but the implant doesn't. Once it osseointegrate to the bone, it's like an ankylose. It doesn't move. So that's why it's not recommended. We wait until the patient is like 18, 20. When everything is stable, then we go ahead and place the implant. And
Right. Are you able to give, like, I don't need an exact price, but a range for dentures, going from maybe what the cheapest could be up to the highest, and the same thing for implants?
So that's a good question. I think a lot of patients sometimes think they're very, very expensive. It depending what you want. Sometimes they're not. They're not expensive because so I have a lot of patients have like implant. I don't want to go there. It's too expensive, and just like I show you, sometimes with simple 2 implant and just placing 2 implant, you can use the same denture for the patient. It can range to no more to between 2,000 to 4,000, let's say, just to have that, which is not too bad. Like having 2 implant and use the same denture. So usually like around, like I said, it could be like 2,000 for those mini implants, and they're very easy to do, and you can have it the same day, like place the implant and have this the same day. And it can range to something like this. This is expensive because there's a lot of bone graft and implant, and the zirconia, it's expensive. So those, they range really between, I will say, 25 to 35,000. That's the most expensive, kind of like
$25,000
for one arch.
Oh, wow.
Because it'll only look like that, but there is always like 6 or 7 implant. There's bone graft, there's tissue graft. Sometimes there is sinus left involved. But with simple implant like that, you can have a denture that is fixed. You can chew your food, enjoy, get your confidence back. It doesn't have to be, like a full fixed prosthesis. So there's a range, I think, for price that you can discuss with your dentist and decide what's good for you and what's good for your finances, I guess.
The other question, and this is one that, I don't know, I'm just taking a chance on this one. How diverse, in your opinion, are insurance plans? Because I hear a lot of people, they don't get a lot because there's not a lot of coverage in some of the plans. And so are there plans that you know of that?
So the plans, because insurances there's a lot of insurances over there. But most of insurances, because to get to this point, usually there's a lot of work right before implant. You have to extract the teeth, do the bone graft, and do like a regular denture like this before transitioning from this to this.
Right.
So a lot of insurance cover that. A lot of insurance cover kind of like the extraction, the regular denture, and all that. So it kind of like cut the price in half. Even the government, like Medicare and all that, will cover regular extraction and dentures and all that. So the patient will be left with the implant part, right? So it kind of like already gave them a break. Not a lot of insurance cover this. Almost none of them cover this. So a lot of patients, when they come, they already kind of like think of it as an investment. They really want to do it. I don't see a lot of insurances covering this. Maybe like when you place 2 implant like that or 4 implant, they cover a little bit. And like I said, the insurances are, like sometimes PPOs and all that, they cover more. Some of them have 50% of the implant, cover 50%, and some of them doesn't cover implant at all.
At all. Wow. Wow.
Yeah.
How long does the implant process take? For our mom, I think it was about a month, which was, good. We were happy with that. But how long does it?
So usually, like when you place an implant, it all depends on your bone. you know, in our body, different area have a better bone than others. Like
Right. That's
those
true.
lower anterior are the best bone we have. The upper posterior is the worst bone we have because it's spongy and all that. But usually when you place an implant, for me to be in the safe side, I usually wait 4 months. 4 months before engaging an implant, before putting a crown on top of the implant. And sometimes if the bone is very strong, when you place it, it's the torque, it's very strong, you can restore it within 2 months sometimes.
Oh, okay.
Within 2 months,
All
the
right.
implant
That's
is ready.
That's
Yeah.
reasonable. Are there ever reasons why an implant or implants would not be a good choice for people?
So the implant is really amazing, the success rate that the implant has. I mean, it's over 99%.
Oh, that's good.
And I've been doing implant for a long time, so it's very hard for an implant to fail. Most of the implant, if they fail, they will fail within the first year. After a year, if the implant is there, it's most likely a survivor. So unless if the patient is a smoker, so that's usually a no. That's where I see a lot of failure of the implant.
Okay.
And there is other things where sometimes the patient has like osteoporosis or diabetes. Sometimes you find more failure on those cases. But smoking, it's one of the
big ones.
Yes, one of the big ones.
When you say failure, how does a person know that the implant is failing them? It's not working.
So the implant does not have it's like it's working or working a little bit. So it's either an implant survive and it's integrated or it's not.
Okay.
So there is no in between.
Right.
You know, there's no like, oh yeah, it's holding a little bit. So when you place an implant, if it fails, the patient will come back within 3 months, either with, let's say, inflammation or pain, because you're not supposed to have pain when you have an implant. After that, if you're having pain on an implant, something is wrong.
Yeah.
And even when that happened, and it happened, what do? You remove the implant, you clean it, you graft it, you put some bone there, you go back and place another implant.
Okay.
So it doesn't mean like if it failed the first time, it will fail a second time. So it does happen, and a lot of patients sometimes will go and place another one, and maybe like work on not smoking or anything like that, and usually that's it works, yeah.
So, given what you just said, so on the other side of that, what is the lifespan of an implant?
So that's a good question. So usually, like when I've been practicing for a long time, and sometimes I'm seeing, you know, implants from the 80s, like because, like I said, once they survive, because an implant. It was found by an accident, you know, like you know, like once it's osseointegrate to the bone, it's over. That's it, unless if you break it mechanically or it doesn't fail. Like if it fail, it will fail within the first year, like I said.
Oh, okay.
So once you place an implant and you take care of it, means you go to your dentist, make sure everything is clean. It's just like your regular teeth. You still go to your dentist, do your 6 months checkup and clean the teeth, clean around the implant. I think the success rate it should last for a very, very, very long time.
Right.
And I'm seeing it now, and the technology now it's even better than before. So I can see it lasting for a lifetime. Why not?
Well, here's a question that I have had, because I've had to personally, not in dental work, but just in everything, in business and everything. There's so many scams out here.
Yes.
And so you see so many places like, oh, you know, come in, we do dental work, you know, and we'll have you out in 2 hours and blah, 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 blah. Are there scams are there things that people need to watch out for?
Yes.
When they're
I honestly, for implant, like if anybody is interested in implant, it should be done with a specialist. It should be done with implant, the restorative part like that, it should be done with a prosthodontist. Because most of my work, what I do a lot of redos. A lot of patients come with failed prostheses like that, and you just have to do it like if you're doing a surgery, you want to go to an oral surgeon and do it, or a periodontist. If you want to do a restorative, this is a work of a prosthodontist. So I think like doing your homework, looking at the dentist, what they do and what their training are, because a lot of dentists sometimes, you know, especially new graduate, are not exposed to a lot of cases like that, and it's very challenging. So, like I said, if someone is interested, I think doing the homework, trying to go with the specialist, you know, that does those kind of work and train to do them, so you don't get any surprises. That's the that's my advice when it comes to.
Now, here's another question that's kind of a pet peeve of mine. A lot of people just don't go and get regular dental appointments. I mean, sometimes I've been guilty in my entire life of that. Sometimes, not here lately, now that I'm older. But what is your recommendation about that? Because I think sometimes people think, oh, well, you know, you don't really have to go to a dentist, you know, every 6 months or every year. You can wait 5 or 6 years.
Oh, yeah.
You know, I mean, I'm wondering how many teeth could have been saved if maybe somebody.
I think this question I answer it every single day to my patient, because you can have a lot of problems with the teeth and you have no pain. The one thing I want to say, having no pain means nothing. It doesn't mean that you're okay. That's why you want to see a dentist every 6 months. Every day I'll see a patient in my chair. I'll tell the patient that some of the teeth needs to come out, and they like shocked because like, I don't have any pain. I don't know what you're talking about. And you show them in the X-ray, and the tooth is completely destroyed. And because they don't, sometimes, like you said, they don't go to see a dentist, and you can have a lot of problem with the tooth without having any pain. And that's why I recommend from patients, since they're 6 months, to see a dentist every 6 months until, you know, they're older. You always want to see a dentist, because you can have a lot of problems without feeling anything.
Right.
So, yeah.
And can dental problems cause other health problems?
Oh yes,
Yeah.
yes. I mean, it can reflect in your health, your heart, and all that. Because if you have an active infection in your mouth, you can have, like I said, infection in around the teeth, and you don't even feel it, and that can, you know, that can have effect in your general health. And a lot of patients, sometimes before doing any surgeries, they come to us to do a dental, you know, dental check on all teeth, and we have to sign off on them that, you know, they're infection free or everything is okay before even they do a surgery. So I see a lot of patients coming down, they're having that little paper, and can you please sign, make sure I'm okay before I do this surgery.
Right.
So yeah, it is.
That's important.
It is very important. They're your teeth. I mean, there's nothing better than wearing that, you know, smile and all that.
That's
so,
true. That's true. Dr. Filali, you are the recipient of multiple accolades, including awards in dental research and clinical expertise. You're fluent in English, Arabic, and French. You enjoy traveling all over the world, and I think just recently you've been doing some work in Guatemala where people didn't have dentists and dental care, and you've been doing that. What advice can you give to young people who might be considering a career in dentistry, but they feel that, you know, maybe they don't have the energy or endurance or finances to become a dentist or a prosthodontist like yourself?
You know, to tell you, I mean, it's dentistry, you know, it's the best thing that happened to me. I love being a dentist, and to succeed, you really, you know, like you have to like the profession. That's and you have to love being a dentist, because it's hard, and if you don't love it, it's hard to succeed. I mean, I will do it again. I will do it again anytime. I will do it all over again anytime, and that's how much I love it and enjoy it. And I came to this, country, and it was harder for me because I didn't speak the language and all that, and I had to work like small job here and there, and to do it. So. And what pushed me is the love of the dentistry, and especially it's not always about the money. I mean, like a lot of people sometimes think it's about money. It's when that patient, when you finish the work and that patient tell you thank you and they smile. Yeah. This is priceless. It heals your soul. Yeah, it's true. And you can take that and come back every day to work. So.
Well, we are just about out of time, but
yes.
I would love to have you come back.
Absolutely, yes.
I think I'd like to talk about the children, because I think that's important.
There's a lot to
that
talk
parents
about that,
get started early on the teeth of children. So if you agree to come back, we'll work on it.
I will, and thank you for having me.
Thank you.
It's really enjoy it.
We appreciate it.
Giving some information, because it's an interesting topic.
Thank you.
To
thank
talk
you so
about.
much.
Thank you.
And thank you for watching Rock Your Block with dentist Dr. Adam Filali of the Dental Bright offices in Tyson's Corner and Chantilly, Virginia. If you have questions or comments for Dr. Filali, his information is scrolling on the bottom of your television screen right now. Remember, do not forget to schedule an appointment with your dentist today. That visit may save your beautiful smile. I'm Tia Young, and I expect to see you next week for another great show on Rock Your Block. Bye-bye.